Well, as you can see, it's another wonderful day, another wonderful opportunity to learn something new, especially something that will benefit your eye health and your health in general. So, today we are going to look at diabetes. So, this topic is going to lead us to what we call diabetic retinopathy, the causes of diabetes, implications, signs and symptoms, management and treatment options of diabetes, and especially diabetes retinopathy. So, we are going to talk about how diabetes affect the eyes. What is diabetes, by the way? What does a diabetic eye looks like? What are the implications of diabetes, especially when it has to do with the eyes? So a very big question comes up when talking about this topic, and that is, what is the leading cause of vision loss and blindness in older age or young working adult? And the answer is sugar, which is the major things that causes diabetes. So stay tuned, don't go nowhere. By the way, my name is Dr. Fee. As you already know, I am always bringing you relevant and accurate eye care tips, helping you know more about eye health and helping you see your very best today, tomorrow, and in the nearest future. If you are watching me for the very first time and you would like to learn more about eye health, kindly click on the subscribers button. You can as well turn on your notification button so you don't miss out on any of our educational videos. On this channel, you will learn a lot about the eye, vision, and eye care tips for the best of eye health. If you're already a subscriber, a very big shout out to you. Keep on keeping on. We are always here to bring you good news, educational videos, and videos that will benefit your eye health and your health in general. Well, just to let you know, if you do not know, diabetes is a major health challenge affecting everyone globally in the entire world. Even the World Health Organization has estimated millions of people to have this issue. So, going back to the question, what is the major cause of vision loss and blindness? It is diabetes. So in this video, I am going to educate us. I am going to let us know how diabetes affects our eyes. What can we do if we discover that we are diabetic, or if it runs in the family line, what can you do to be on the safe side? So that is the major reason for this video. More especially if you have someone close to you that is of age and cannot help his or herself, this video will help you guide the person on what to do to be on the safe side. Diabetes does not only affect your general health, it also affects your eyes, specifically your eye health. So that is the more reason you always need to visit your eye doctor, get your eyes checked regularly to know if there are any signs of diabetes, so you can be on the safe side. And do not forget that some signs that your eye doctor might discover during regular eye check can also let you know if you are diabetic or not. And if you are, the stage or level of diabetes. So very important to point out to us that there is a need for us to always appreciate our eye doctors. They have been doing a wonderful job. For instance, some certain health issues can be detected on regular eye check. You can go to the eye clinic to check your eyes, and after all said and done, your doctor can detect some other health complications from your regular eye check. For example, diabetes retinopathy, which is caused by diabetes. You might not really know if you are diabetic or not, but during regular eye examination, your doctor can see some signs that means that probably you have maybe the early stage of diabetes. So it is very important to appreciate your eye doctor, even in the least possible way. So at this point, I want to make it clear that regular eye checkup is not just for patients who want maybe glasses or medication for their eye health, but it is for everybody. Now, most patients with diabetes do not see the need to get their eyes checked regularly because probably they are not having any serious vision complaint or complication because the diabetes may be at the early stage. But that is even the more reason they need to get their eyes checked regularly so that things can be brought under control and taken care of. So, regular eye checkup is not just for people that have vision problem, but for everyone. And on this topic, people with diabetes need to take their regular eye checkup seriously for their own good. Now, going direct to the important question, what is diabetes? In a very simple way, diabetes is a situation whereby the blood sugar is high, excessively high, because the body cannot utilize or maintain sugar or probably send it from the bloodstream to the different cells of the body where they are needed. Mind you, diabetes can affect different parts of the body, but in this video we are focusing on how it affects the eyes, and that means how it affects vision or how it can cause vision loss or blindness. So briefly, diabetes is majorly of two types, type 1 and type 2. But like I said earlier, we are focusing on how it affects the eyes, and that is what we are looking at. So when diabetes affects the eye, it is called diabetic retinopathy. So in this video, we are going to talk about diabetes retinopathy, how it affects your vision, the implication, the causes, the symptoms, and a lot more. Now, bear in mind that diabetes can affect different parts of the body. The different type of diabetes affect the eyes differently. The effect also depends on how long someone has been diabetic and how good he or she has been managing the whole situation. Looking at the structures of the eyes during image formation, you find out that there are a lot of structures and part of the eye that are involved in image formation, like the front part of the eye, the cornea, the iris, the pupil, which allows the required amount of light to enter the eye. Then at the back of the eye, you have the crystalline lens, which help to adjust the light. Then the other space, which is filled with the vitreous humor, is also involved in one way or the other. Then going to the retina at the back of the eyes, where image formation takes place, especially at the macula. This whole process takes little or microseconds. Then a signal is sent to the brain through the optic nerve. But there is a bad news, which is the fact that diabetes affect the optic nerve. So imagine a situation whereby the optic nerve, which is supposed to send signal to the brain and let you know what your vision is all about or what you're seeing, is affected by diabetes. So this is the more reason why, as a diabetic patient, you always need to get your eyes checked regularly. Like I said earlier, the effect of diabetes on the eye is what gave birth to diabetic retinopathy, which I consider as an emergency. It's something that you need to treat with urgency. It needs a lot of attention. Now, diabetic retinopathy can cause what we call diabetic macular edema, when there is accumulation of fluid in some blood vessels in the retina. And when this break, it can lead to leakage of blood or other contents into the retina, especially the small part of the retina, which is the macula, which is the major site for vision formation. Now, imagine a situation whereby the place or the part of the retina where images are formed is blocked with leakage of blood or other content. The implication here is that vision will be blurry or distorted. And if nothing is done about it, this can continue for a very long time. The vision will continue to be blurry and it can lead to blindness. So, one of the implications of diabetic retinopathy is diabetic macular edema, which can lead to blurry or distorted vision. Another implication of diabetes retinopathy is that it can cause permanent damage to some of the blood vessels in the eyes, which will in turn affect your vision in one way or the other. This can reduce your vision, make it blurry or distorted. Poorly managed diabetes can also cause other eye conditions such as cataract and glaucoma. Remember, I said earlier that diabetes affect the optic nerves, which are responsible for sending signals to the brain during image formation. These signals let the brain interpret and tell you what exactly your vision is all about, what you're seeing. So, in a situation where those optic nerves are gradually damaged or they are gradually dying off, probably you have glaucoma, because the major cause of glaucoma is the inactivity or death of this optic nerve at the back of the brain. Diabetic retinopathy can also cause swelling of the crystalline lens. This, in one way or the other, will affect your lens, your corrective lens prescription. Probably if you are a myope, it will increase your lens prescription, or if you are a hyperope, it will increase your corrective lens prescription. So these are the complications of diabetic retinopathy, which should be taken into consideration. And the more reason you always need to get your eyes checked. Have your blood work done so that you know if you are free from diabetes or not. Another implication or effect of diabetic retinopathy on the eye is what we call retinal detachment, which is also an ocular emergency that should be taken very seriously. The effect of diabetic retinopathy on the eye depends on the level of diabetic retinopathy. And as you already know, diabetic retinopathy is caused by diabetes. So, just to summarize the implications of diabetic retinopathy, it is the major reason why people with diabetic retinopathy have a lot of swelling and bleeding within the eyes. It is the cause of increased blurring of vision or distorted vision, high risk of glaucoma and cataract. Also, like I mentioned just now, retinal detachment, and as well, a shift in the lens prescription of some patients in a situation whereby a patient is myopic or hyperopic. The particular power of lenses that is giving them a better vision has to shift. Maybe probably the person was using a -2 for near correction, then all of a sudden is going to -4 or -5. These are the complications of diabetic retinopathy.